morning, officer. How are you?
Morning, sir. How are you?
Ready to fly back?
Ready to fly back to New York. Listen, I feel compelled to say this. Obviously I'm a New York City police officer. I had 2 failed pterygiums in my eye from New York City. Butchered the second time. I feel I was left with a massive scar. Pterygium grown almost over to my pupil. Unable to walk outside without feeling like a foreign body's in my eye nonstop, and irritation in my eye. Reached out to several different surgeons from New York, and they couldn't help me. They said they don't see what they could do any different. They weren't comfortable doing the surgery. Thank God I came across you, to be honest, and I heard so many other people talk about you and rave about you, and right after surgery and coming up to these mirrors, and now I understand what you're talking about. I'm part of that now. The compassion you have for people, the experience, the knowledge, the love, it's real. And I want to say this because when I was looking at that screen at people, listening to them, I said, is that real? I was skeptical. I'm going to be honest. I have 3 children. I'm from New York City, Bethpage, Long Island, and it was not easy to come here. There's a lot of working parts that make this whole thing possible. And I just want to say thank you so much. You turned a pterygium into a clear eye. You turned an 8.2 stigmatism in my eye to virtually nothing. How? And I had surgeons tell me they don't see what they could do any different. So how does Dr. Gulani, what is he doing different? I'm proof. I'm living proof that there is somebody different. He's right here in Jacksonville. It's amazing. And I just feel really compelled to say that. I need this to express myself to other people that are skeptical, doubtful, or going through something that they cannot believe that there's somebody else out there. And there is somebody else out there. He's right here. And I've witnessed at least 15 other people just a few days ago and listened to their stories. Now I'm part of that story. And I want to thank you for that. From the bottom of my heart.
It truly is amazing. Like, just looking at those pictures, it's truly amazing. Just to anyone looking at that camera right
and
there.
And the relief from my eye, not even 5 days. My eye's comfortable. I'm walking around. The light's not blinding me. I felt compelled. I really want to say this, and hopefully this gets out to people and just listen to my story.
And who are searching
for somebody that spectacular. They're out here. He's living proof. He's standing right in front of me. He did my surgery.
He's willing to go
above and beyond, above and beyond. The compassion, the love. As soon as you walk in, he's not ready to run out here. He's constantly explaining things, breaking it down to me, explaining exactly how. I'm not an eye doctor. I'm a cop. He's explaining how this works. Look at my stigmatism. Look what you're going through. Of course you're having irritation. Of course it feels like something's in your eye. It's pulling on your eye. And now look at my eye. It's not even 5 days. It's amazing. It's truly amazing.
Thank you, Dr. Gulani.
Thank you so much. Bottom of my heart. Seriously.
Thank you. Thank you so much.
You guys
Yes, we do.
Yeah. It's a pleasure. Well, you gave a lecture there, but all of you are really part of my story, my life too. Fighting for y'all. For doctors, they're always watching impromptu. They do these recordings here on Mondays. Patients are coming in again today, Anthony, like y'all did last week, from all over the world, all with complications and complexities, and told nothing can be done.
Yes.
And then day 1 after your surgery, remember, you walked up to the mirror.
And I couldn't believe it.
And then how many people you saw from all over the world on day 1 post-op?
At least 12 to 15 people. And their stories, very powerful stories. Nothing could be done. They don't know what they could do. They don't see what they could do different. You got to live it like that. You can't live like that.
It's a pleasure for me to fight for y'all. I mean, for doctors watching, the reason they pulled this up is to show you the patient had a very extensive recurrent pterygium. He's had the surgery 2 times and had severe scarring on both sides. And This is him right away. Entire cornea has been cleared. The entire area looks nice and white. If you look at his eyes, please. Look straight ahead. And you can see this entire area on the medial side white. That's the area of the human placenta. Not any stitches, sorry, sitting with you. And you can see the impact on the vision, why he's seeing so well. You could see 8.2 diopter astigmatism from that very bad recurrent, 2 times recurrent pterygium, and he's been down to straight 0.6 or nearly half a diopter from 8.2. And you can see the difference map here. So these are very important things, not only to perform surgery on these difficult cases, but to also deliver them cosmetically. He was made to walk to a mirror next day, and this is not a virgin pterygium or Pinguecula, it's a very aggressive recurrent pterygium complication. And then besides the day one, he's here today just because he was in town having fun on the weekend.
Yes.
And I must see them before they fly out, it's a pleasure. And getting to measure them, it's another pleasure. And sharing with doctors all the time. So please don't say no to these patients or any patient. Fight for them. And not only perform on their bad eye, but take it to an excellent level of outcome. Visually, cosmetically, functionally. His eye movements are back perfect normal now because we even cleared the muscle area with human placenta and laid it there and made it everything clean and identifiable. Right? Be the most amazing cop you are in New York.
Thank you, sir.
Safe
Thank you
travels
so
back.
much.
Absolute pleasure.